Imagine growing up in a place where healthy food is hard to find and doctor visits are too expensive. Over time, that leads to higher obesity rates and serious health problems. That's what many families in the Rio Grande Valley face every day. Hi, my name is Hunter Serna, and this is
Jacob Reyes.
I'm Kailey Pinon.
And I'm Bethany Perez, and today we'll be discussing about obesity in the Rio Grande Valley and how it affects our region.
Obesity doesn't just affect individuals, it impacts entire communities through higher healthcare costs, lower quality of life, and future health problems. As residents of the RGV, we have experienced this ourselves, personally and within our own community. We spent weeks researching the causes and effects of obesity in the RGV with credible sources that have been fact-checked. One example being the Texas Tribune and a recent 2025 study from the journal Obesities. These sources provide us with a deep insight on the specific barriers our community faces upon these challenges. Obesity is a chronic disease that currently impacts the Rio Grande Valley at rates exceeding both Texas and national averages. To address this, we propose and advocate for the expansion of Medicaid coverage and the addition of education programs to provide residents with the medical and nutritional support they need. We will first examine the serious obesity problems in the Rio Grande Valley. Next, explore the healthcare and food access barriers that cause it, and finally discuss how Medicaid expansion and education programs can solve the crisis.
Thank you, Hunter. To understand how we can create a solution to this issue, we must first look into how major this issue really is. According to a 2025 article by Bethany Garcia in the Texas Tribune, there is an urgent push to fight obesity through weight loss because our region is a hotspot for obesity-related issues. This isn't just an observation, it's a statistical fact. In a 2025 study investigating environmental and socioeconomic contributors to adult obesity in the Rio Grande Valley by J.N. Kaba, he and his team found that regional obesity rates are higher than national averages. They know that environmental factors like lack of safe places to walk and high costs of fresh produce make it almost impossible for many residents to maintain a healthy weight without support.
Thank you, Jacob. Now that we've established this issue, what is the root cause of this? The study, Uptake of Centers for Medicare and Medicaid Obesity Benefit by Bethany and by Noon in the 2016 journal Obesity. This shows that it's not just the patient's wallet, but a broken system. Even though frontline clinicians are the first lines of defense, the study reveals that low reimbursement, severe time constraints, and lack of training for these professionals prevent patients from getting the help they need, despite the Medicare benefit existing before. Limited access to nutritious food and safe recreational areas possesses a significant barrier to health in certain communities, like the Rio Grande Valley. The study, investigating environmental and socioeconomic contributors to adult obesity in the Rio Grande Valley, highlights that the RGV has markedly lower access to exercise, higher rates of physical inactivity, and lower food environment index scores compared to the rest of the state and national average. Furthermore, the study notes that the high prevalence of food deserts in the RGV, where fresh produce is difficult to obtain, demonstrates how environmental barriers directly fuel high obesity rates in the region.
Thank you, Kailey. But however, what are some ways we could solve this humongous problem we have? According to Garcia 2025 in the Texas Tribune, there are many programs that are being used to help fight obesity, which are being implemented by UT Health Houston schools. These programs encourage active fitness through free gyms, nutritional information, and making city infrastructure more physically demanding for citizens to encourage weight loss. In the same source, it states that 15,000 people have participated who have collectively lost more than 23,000 pounds, showing that this program does work and helps many here in the RGV. By improving Medicaid programs locally, we provide low-income residents financially to seek care over their health. This allows them to find help from nutritionists and doctors before obesity becomes a permanent factor in their lives, making it life-threatening. Research has shown that these benefits work when they are easily accessible. In a study published in the journal Obesity, the researchers Batsis and Bynum wrote in their uptake of the Centers for Medicare and Medicaid Obesity Benefit 2012 and 2013 that when medical obesity benefits were utilized, there was a noticeable improvement in patients' health. If we can make these programs more accessible, we provide our community with these tools they need to fight these health barriers Kailey just mentioned.
Thank you, Bethany. After reviewing the ways that these educational and physical programs have been able to fight obesity, it's important that we refresh everything we have learned from before. The RGV faces strong health issues, with obesity rates reaching higher rates than the rest of Texas. This crisis is fueled by barriers like a lack of money and access to doctors, treatment, healthy foods, and a safe place to exercise. Expanding Medicaid will not only help, but it provides the medical safety people need to manage chronic conditions. Combined with the education about nutrition in schools can help produce programs to empower families to break the cycle of obesity in their community. Obesity in the Valley isn't failure of willpower, but failure of access and support. By advocating for expanded healthcare and education, we can make sure that our location no longer dictates our life. Let's work towards making the RGV a place where health is a right for every citizen and family, not just a luxury for a few people.
This has been Jacob Reyes,
Hunter Serma,
Kailey Pinon.
I'm Bethany Pettis, and thank you for your time.